Hey, everybody, this is Romulo Vega from Quest for Fire, the podcast, and delighted to be joined by a special guest today from episode 28 of Quest for Fire. We have Jaden Perkins, who is serving as a member of the Revolutionary Action Party, but also will be master of ceremony for a rally that's in support of Medicare-For-All. Medicare-For-All, universal single-payer healthcare coverage in the United States of America. But first and foremost, Jaden, how you doing today?
Good. How are you?
Doing well, thank you, and very excited to learn about this rally that you have planned for this Saturday, July 24th, at 4 o'clock in the afternoon in Omaha, Nebraska. Can you tell us, why is this event happening, and what messages do you want to convey to the community?
So Medicare for All, or the March for Medicare for All, is a nationwide grassroots-led movement in 55 cities across the nation to march for the implementation of the most popular healthcare policy out there, and that is Medicare for All. Thousands upon thousands of people in solidarity with over 300 organizations nationwide and worldwide are banding together to say that we have had enough of the for-profit racist health insurance industry that exists today. And we've had enough of paying the extra fees and the extra co-pays that come with just a simple doctor's visit. Healthcare is a human right for all and not a privilege of the few.
You know, when you talk about healthcare, that's a very interesting topic because you reference the popularity of this idea, and it's one of those things where, healthcare is something that you need, really. You don't need it until you need it, right? And if it's not there, then it's a major issue in your day-to-day life. And the way we have things set up right now with an employer-based system, it depends on who your employer decides to partner with to offer you that type of private coverage. And then if you have your own family or dependents, that's definitely something that'll impact financially your paycheck. When we talk about folks who may not be employed or may be facing certain financial limitations, they might qualify for something like Medicaid. When we talk about elders in our community, they might qualify for something like Medicare. And one thing I forgot to reference is also like those who served in the armed forces might have access to TRICARE, which is a little bit different than all these other approaches that I've talked about. But tell us, Jaden, why would Medicare for all, so all Americans, why would that be something that would help the working class American save some money and get better coverage?
So Medicare for All is the only policy out there that reduces costs for the federal government and for the consumer. I mean, there's a savings for the federal government at about $650 billion a year if we implement Medicare for All over the next 4 years and beyond. And then for the average American, they'd see the average price that they're paying for their health insurance cut by more than half. Honestly, I mean, Americans are paying thousands upon thousands of dollars a year into a health insurance industry that is continuing to give raises to their CEOs and continuing to deny people the rightful access to health care. And so this would be a definite cost savings for everyone across the board while delivering 100% of healthcare coverage to the citizens of the United States.
In talking with family members and community members, I hear some very interesting things about the intimidation of going to seek medical treatment because you might not be able to afford it, as well as the cost of a certain treatment you might have no other choice but have to pursue, or a prescription drug that if you don't access that drug, it's not like it's a discretionary consumer good. It's you need it because you need it to stay alive and live live your day-to-day life. And folks are very concerned, I guess, for the cost, and they're intimidated. And, what kinds of comments have folks been sharing with you as you've been planning this rally for Medicare for All?
So the reception has been overwhelmingly positive. I've gotten tons of folks who've said to me personally, or have texted me, or posted on the event page that they're thankful that Omaha is hosting this conversation about why we need healthcare for all. Either because they've had a family member or a child or a parent pass away from the simple lack of healthcare. And so I think we're going to see a great turnout just on that fact alone, because again, healthcare is an issue that affects everybody.
I was taking a look at the event that you have on Facebook for the Omaha Medicare for All rally, and one of the comments that I saw on there was that Black Lives Matter is a healthcare issue. Can you expand on that?
So if you believe in Medicare for All, or if you believe in Black Lives Matter, then you have to believe in Medicare for All. Black, brown, and indigenous people have been at the brunt of the healthcare system that exists today. The statistics for certain diseases and health outcomes are among the worst among Black, brown, and indigenous people. And so it's finally time to abolish this system that has been predatory, especially and oppressive towards our people, once and for all, and finally deliver a policy that will shore up the racial health gaps in this country and ensure 100% of coverage for healthcare for Black, brown, and indigenous people. So I think it's an important issue, especially to our community, because for a variety of reasons, and it's time for something different. What we've seen over this last year is an uprising of people saying, we've had enough of this system, we've had enough of this. And so I think it'll be a beautiful conversation on Saturday, and I'm excited to educate the masses on that.
Now, you have a lineup of speakers that are going to share some remarks. I mean, can you give us any glimpse? What kinds of topics are they going to touch upon, or any sort of, insight you can share with us today?
So I specifically chose the speakers. I wanted to be intentional about what this event was going to be about. And obviously that's about highlighting the racial health gaps that Black, brown, and indigenous people have been facing for all of time. And so the speakers that we have, they're all either Black, brown, or indigenous. We have a Native woman from Lincoln speaking. We have a rap organizer speaking. I'll be speaking. And then we have a trusted local health physician speaking. And so we wanted to really highlight that conversation from those perspectives to make sure this event is as meaningful and intentional as possible.
All right, and we'll save things for final thoughts here. And I just want to applaud you for putting forth this event and organizing it. I feel, and one of the things that I'm really focusing on is just that Overton window of what's achievable, what's acceptable as a society, right? And I feel there are other forces out there that make it very intentional to only tell us that certain things are achievable. Certain ideas are the ones that have merit, and everything else is radical or whatever type of wording you want to use. So, as a last thought, I guess, to break it down just in very human and authentic terms, I mean, what are you trying to achieve, and what would this do to make our society a little bit better?
We are trying to achieve awareness around why we need universal health care, especially for our oppressed communities. And so I hope this conversation on Saturday really highlights that, and we continue to have more conversations on why we need universal health care. Like I said previously, 7 out of 10 Americans support this policy. In Nebraska specifically, we passed Medicaid expansion overwhelmingly back in 2018, about by 60%. and the governor has been blocking it since then. And so that tells you that on the issue of healthcare alone, the people are on our side. The people agree that it's time for a different system that allows people to pay less and get more out of the system than what we currently see. And so, you know, like I said, I just hope people can turn out and really listen to what the conversation is going to entail on Saturday. Very excited for it.
Excellent. So that'll be this Saturday, July 24th, Omaha, Nebraska, in the Old Market. You can find more information on Facebook. Just it's an event as Medicare-For-All rally in Omaha. Jaden Perkins from Revolutionary Action Party, Master of Ceremony for this upcoming rally for Medicare-For-All. Thank you very much for your time, and we'll see you on Saturday.
All right. Thanks so much.